Respected ladies and gentlemen, I'm Promit. I'm one of the active members of a small NGO called Sunshine India Foundation. Today we are extremely glad to have Dr. Arnab Gupta, the Medical Director and Cancer Surgeon for Saroj Gupta Cancer Center and Research Institute. Before we go forward, it would be really important to go a little backward. Dr. Arnab Gupta is son of late Padma Shri Saroj Gupta, who started his endeavor in 1973, and from 1973, from 25 beds, today this hospital has precisely 311 beds, and we all know that journey was not smooth. It was a bumpy ride. And there were people, a social group of people, like as we are trying to do something for the society, without any interest. They were with late Dr. Gupta, and consequently, his able son, who is an MBBS, a medical graduate from CNMC Calcutta, and FRCS from Royal College of Surgeons, Edinburgh. Probably he would have, like any NRI doctors, I'm not blaming them, he could have stayed back in London and probably earned, money is important, and could have earned into factors whatever he's earning today. But he never did that. He came back to continue his father's wish and ambition to serve the oppressed and the poor patients whom, quote unquote, the bother of his hospitals don't provide. So Dr. Gupta, welcome to our world, a very little world of sunshine in India. The very first question would be, I know you are extremely busy and we are so grateful that you could give us some time. And before we start, we would also like to say a little about us. As in, we have founded this NGO called Sunshine India. An NGO for some reason has become it is no more a noun, it has become an adjective, and a bad adjective, as if, and NGOs are chore and thugs, and they swindle money and all that. But nevertheless, these are like side effects of any good work.
Yeah.
So again, welcome to our world.
Thank you.
A little, cancer has become, kind of the growth of patients who are suffering from cancer is fast growing. I think just going through some data, you can really highlight more on that. I think in 2021 it was some 24.5 million in India,
Yes.
which is like 25 koti. And then it has gone, and the predicted figure is
Thanks, actually.
তাহলে 35 লাখ, sorry, তাহলে 30 লাখ হবে। So it will go to 30 lakh in 2025. So what do you think, why this growth is happening, where science and technology is also developing?
Right. Well, there are 2-3 reasons. Obviously, people are living much longer. When I was a medical student, the average life expectancy was 57 years. That has obviously increased. So people are definitely living longer. Lifestyle has changed significantly. Our past, you remember, whenever I had any mobile or fast food, we used to live mostly like the way our ancestors used to live. Similar kind of diet, similar lifestyle, not much of stress. So I think the whole thing has contributed. The pollution has increased for sure. And I think there's also the third factor, which is more detection. A lot of people used to die without any diagnosis in the past. Now we are doing more frequent tests. People are coming up to us, get them checked, and we're doing much more tests. So we are picking up more cancers which probably were not picked up earlier. So those three factors would be most likely.
What exactly cancer is medically? In a common man's world?
Yeah, basically, the cells keep multiplying, as we know. The child grows from a childhood to an adulthood, and obviously the cells stop dividing at that point. The control is by the gene. If you have a cut, you'll see the tissues growing back again, and then once the healing is complete, there will be no more cell division. So the control is by gene inside the cell. If the gene goes wrong, then that's a problem. Obviously, the cells have no control; they will keep multiplying. And how will the gene go wrong? That's how we need to know that how cancer happens. So we know certain factors which can cause this unlimited cell division by genetic change. The genetic change can be inherited from the obviously parents or the grandparents, or it could be the kind of lifestyle that we live. So the genetic change can happen during our lifetime also. So this genetic change is one thing which will obviously not come to the cell division anymore.
Sir, I'll just interrupt for a second. Like, a lot of researchers are saying that cancer could be genetic also.
Yeah.
Is it true, sir?
Yeah, in 5% of cases. So if you see 100 cancer patients, only 5 of them will be having genetic factors or the hereditary factors.
Otherwise, it's a lifestyle or an acquired kind of.
And some cancer, unfortunately, is still known the cause. So
Yeah.
I think almost 50% or 60% of cancer causes are known. And that's how we should be more careful about, because once cancer happens, obviously, it's almost like you're already into the battle. But if you can prevent yourself from going into the battle, that's how we should think about it. So if you know the factors which cause cancer, you can be much more careful. You can do many more things which will prevent cancer. So I think that's something worth discussing actually.
আরেকটা প্রশ্ন করবো ডাক্তারবাবু, সেটা হচ্ছে যে অধিকাংশ ক্ষেত্রেই ক্যান্সার যখন ধরা পড়ে, when it is detected, it is in a metastatic stage.
Well, it used to be mostly in the past, but now it is.
No, exactly. So
last 10-15 years we have seen the change.
So is there any early diagnosis system or any symptoms in the body where people would be little conscious and go to a doctor and get it tested?
Exactly. So there will be 2-3 common symptoms. Wherever the cancer is, obviously the symptoms will be according to the place of the cancer. But in general, there will be 2-3 symptoms. One is obviously losing weight fast. So within maybe a month, the person might lose 10-15 kilos. So that's really alarming.
Okay.
In 2 months, they might have lost 20 kilos. So that's something we.
So that's the first indication.
Number one. Number two will be loss of appetite. So all of a sudden, the person doesn't feel like having their normal food that they used to enjoy. So those two are the common factors, common symptoms. And then obviously, depending upon where the tumor is, if it's in the lung, people will be coughing, they will be spitting out blood. If it's in the, say for example, breast, they will feel alarm, there might be blood coming out from the nipple. If it's in the mouth, obviously there will be an ulcer which is not healing. If it's inside the stomach, there will be blood coming along with the stool or with the vomitus. So it depends where the tumor is, the symptoms will be accordingly. But in general, like I said,
reduction of weight is key first.
Exactly, or any unusual bleeding, anemia, these are very common symptoms. Weakness, anywhere the cancer.
See, there are 3-4 diseases which are growing, which are absolutely lifestyle based. For example, my daughter, I mean, in our childhood, our generation, আমাদের খাওয়া দাওয়াতে এখন তো সব খাবারের প্রিজারভেটিভ, গ্লুটেন, তো নতুন যে জেন জি মিলেনিয়াল কি আপনাদের কিছু বলার আছে, মানে যে এই খাবারটা খেও না, এই খাবারটা খাও?
Absolutely, I think same thing is with my problem also. I've got 2 daughters. So basically, I think we have to tell them from early childhood. I think it should be in the curriculum as well to be on healthy diet. What does healthy diet mean? It's like fruits, vegetables, water. Yes, fish, chicken, eggs are fine, limited amount, especially eggs. But red meat should be avoided as much as possible. Once in a while, it's okay, but not regularly. Fast food should be condemned because many of them will be having artificial color and preservative and chemicals. The stored food, they also have a lot of chemicals just to preserve them. So these are things which we should try and avoid. A lot of fat and oily food should be avoided. It's not good for heart, not good for anything at all. So these are things they should know. And regular exercises, just maybe some time of meditation, going out in the fresh air.
Now, I'm also the victim because I have a 17-year-old daughter.
Mm-hmm.
Now, I think this problem is being suffered by all parents.
Yeah.
She kind of thrives on pizzas and chips and colas. You know, in our time, আমাদের সময় আমরা বিকেলবেলায় একটু মা যা খেতে দিত সেটাই খেতাম, বাড়ির খাবার ইত্যাদি, এই গ্লুটেন নানা রকম এইসব জিনিসপত্র। তো একটা কি আমরা ক্যাম্পেইন চালানো, মানে একটু উদ্যোগ নিতে পারি যে বাচ্চাদেরকে বলা, যেমন রাশিয়ায় হচ্ছে, আমেরিকা তো আপনি জানেন পুরোটাই ফাস্ট ফুডে চলে, মানে আমি কোনো দেশকে দোষ দিতে চাইছি না, এক একটা দেশের এক এক রকম নিয়ম। যেমন রাশিয়ান মাদাররা একদম দে আর ডেড এগেনস্ট দেয়ার কিডস টু হ্যাভ ফাস্ট ফুড। তো আমার মনে হয় সেটা একটা অ্যাওয়ারনেস ক্যাম্পেইন আমরা যদি একটু সংগঠিত করতে পারি, সেটা
individual level is not very difficult, but your
yes, and we also need your help also.
So social platform is one thing which is going to be widely reached. And secondly, I think going out to the schools and colleges at different levels from different NGOs. And thirdly, I think the ministry, if they can be more proactive in getting some curriculum implemented in the school, so that from the early childhood they know what is right and what is wrong.
Absolutely.
Because they do get misguided by a lot of Western movies and all.
Yes, yes.
So I think we have to tell them what is right and what is wrong.
Another question, I mean, of course you must be aware of the OTT platforms and stuff like that. Now, mobile phone is one animal, I would say, that which is killing, I think, even the senses and sensibilities of people, right?
Sure.
Apart from killing a lot of industries. And these kids, I mean, to me, my daughter is now an adult, but to my perspective, she's a kid. So she is glue fixed to. I'm not mentioning the names of the OTT platforms, but to Western OTT platforms, wherein they are only learning. See, Western world has their own beautiful ethics. You are in Edinburgh, so you must be knowing. The Western people, we generally blame Western people, but they also have very strong ethics, and we respect them.
Yeah.
Generally, they are very honest. Generally, I'm not saying all of them. But then, how to, kind of balance this? Because when my daughter sees a series in an OTT, and then probably thrives on pizza and colas and chips of the world and atta roti movie, and these are like, oh my god, it's so down market. So how to do that?
It's difficult. I think it's too late to don't have any control on that. I think we should be able to train our children what is good and what is bad. So if they understand that from an early childhood, and if they know how we are kind of very serious about it, why you are serious about it, so if they know that, I think most of the children will respect the kind of guidance from the parents. So I think we have to spend more time with them. There are good things and bad things, obviously, for mobile or any platform, any digital platform. There's so much of benefit. Even I Google whatever I don't know regarding medicine or whatever, because there's change every day. So if I Google, within few seconds I'll know a lot of
Now I have a complaint against you, sir.
Okay.
from the general mass.
Yeah.
Sir, why are you so media shy? Because I have done a research on you, wherein I think the kind of free surgeries you do vis-a-vis the big names in Kolkata. Why are you so shy? You're doing so many good things and people don't know in that way.
What I believe in is, there are certain professional ethics, which can be learned during our early medical school days. So you should not be actually, doing any publicity about, your professional work. Apart from the confidentiality of the patient, you should not be publicizing about your professional work, because it's not correct. Number one, and number two, I believe in word of mouth, which my dad used to believe in. So that actually is something which lasts forever. So if you do a lot of good work, people will gradually get to know. You don't have to tell all the people around that you're doing a wonderful job, but the people who needs to know, they will get to know. So,
sir, I'm a marketing guy by profession. I deal with brandings and PRs. In our grammar book also, the strongest marketing tool, I completely agree with you, is word of mouth.
Yeah.
But at the same time, sir, the world also is changing and changed, and particularly post-COVID was kind of a huge kind of a mixer blender kind of stuff. Probably DNAs have changed, people behaviors, patterns, sleep cycle, circadian system, everything got jeopardized. I would, sir, sincerely request you to please come into digital platform and tell what you're doing, because you are, I feel really bad that so many people are doing one and showing it as 100, and you are doing 1,000 and not showing it to the world.
Like I said, word of mouth is important. Secondly, I think what we do indirectly, I should not be saying that way, but we talk about the hospital because I think that's also important. The hospital also doesn't have that kind of, what should I say, branding. This has been there for last 50 years. We are celebrating the 50th anniversary actually in March. So, unfortunately, a lot of people, even in Calcutta, even opposite this hospital, they don't know what we do. So that's something we're trying to promote. And if that gets promoted, all the doctors in the hospital will get promoted. So it's not really directly promotion for our professional activity, but it's also important that people know what kind of services we provide at a very reasonable cost. People don't really need to go to the west or south or north or wherever, so that they can get the best of facilities at a very reasonable cost and get the best of sympathy,
exactly.
compassion. And all.
This very fact that the hospital which you're running, which is not only a hospital, it's also an research institute.
Yes.
Plus, it is for the oppressed people of the society.
Yeah.
A chemo and a radiation, a surgery and a radiation, and then because I would share my personal experience because my mother got detected with ovarian cancer at a very later stage, and wherein we even could not do the third chemo. She died.
Right.
So that was the reason Dr. Gupta was saying that technology has developed. So figure out your symptoms. There are early diagnostic systems available. Get yourself checked. Get yourself into a regular regime of life in terms of exercise, having good food, and stuff like that. Now, since I'm from Sunshine, I think that is the word of sunshine, and we will do a little moja with Dr. Gupta because we have been talking very serious and grievous issues. So we'll go for a rapid fire session. একটু মজাই করবো ডাক্তারবাবুর সঙ্গে ডাক্তারবাবু হয়তো সময় হয় না মজা করার জন্য
Do I need to wear a helmet or something?
No, sir. I think that will be too celestial. আচ্ছা ডাক্তারবাবু এটা বাংলায় করি মোহনবাগান পেয়েছি
মোহনবাগান আমরা এদেশীয় লোক, so sort of thing. I mean, I'm not saying that I'm against other teams, but if you really ask me, that is kind of what we are actually.
মোহনবাগান যুগ আমি মোহনবাগানের সাপোর্টার উত্তম না সৌমিত্র
Very tough question. I'll tell you, answer this in two different angles. Uttam Kumar, I used to, everybody is kind of very fond of. He has got a different personality altogether. Unfortunately, I didn't have a chance to be, personally kind of known to him, or we didn't have any acquaintance as such. So we missed, that opportunity. He passed away too early. But with Soumitra Chakrabarty, we had a lovely relationship. He was like our family member. He was very close to my father. অনেকবার এসছেন এখানে,
ওনার তো শেষ জীবনে
অনেকবার এসছেন এখানে। ওনার বাবা একটা গল্প বই লিখেছিলেন, গল্প লিখতেন, উনি এনকারেজ করেছেন ওনার বইটাকে পাবলিশ করো, আর উনি ফরওয়ার্ডটা পুরো লিখেছেন নিজে হাতে করে। সো আই থিঙ্ক উই হ্যাভ ওয়ান্ডারফুল রিলেশনশিপ। ওনারা অ্যাক্টিংও কিছু কম না, অনেক অভিনয় করেছেন। But then regarding acting, if you have to really score somebody from my side, I will probably score from Kumar one notch about Soumitra Chakrabarty. As a person, we are very fond of Soumitra Chakrabarty. He's not there anymore.
সত্যজিৎ রায়
I think my generation probably had missed out on Hrithik Roshan. আমার সত্যজিৎ সাথে অনেক বেশি অ্যাকোয়ান্টেন্সটা বেশি, সব রকম বই আমরা দেখেছি, পড়েছি। And he was a genius. গানের সুর কম্পোজ করা, করা, মজার বই লেখা,
অসাধারণ, মানে ওনার গুণের শেষ নেই।
বাচ্চা থেকে বড় যে খুব এন্টারটেইন।
আমার একটাই শুধু সত্যজিৎ রায়ের সঙ্গে দুঃখ হয়, উনি যখন অস্কারটা পেলেন তখন ওনার কাছে অস্কারের মূল্যটা রইল না।
আমাদের দেশে তো তাই, আপনি জানেন, পথের পাঁচালী আমাদের দেশে তো কোনো রিকগনিশন পায়নি till he got award in Cannes Festival. That's when people recognize ওনার যে ট্যালেন্ট আর কি।
ইলিশটা চিংড়ি।
Tough question again. দুটোই, I mean, if you have to really give some equal points to something, I think Ilisha Chingri will score similar to me.
লাস্ট প্রশ্নটা একটু পার্সোনাল, কাকে বেশি ভয় পান, ভগবান না আপনার স্ত্রী?
Toughest question. Well, I mean,
মজা করে উত্তর দিতে
না, আমি যেমন আমি আমার মার থেকে বউকে ভয় পেয়ে গেছিলাম।
মজা করে উত্তর দিতে গেলে ওয়াইফকে বেশি ভয় পায়।
এই ক্লাবটা মনে হয় পৃথিবীতে সবচেয়ে বড় হবে আর কি। যাই হোক, ডক্টর গুপ্ত, অসংখ্য ধন্যবাদ, আপনি আমাদের এত সময় দিলেন, মাঝে মাঝে এসে জানাবো। আর একদিন অনুরোধ করবো, যদি আমাদের ছোট্ট, আমরা কবে শুরু করেছি, ছোট্ট আমাদের এনজিও ইউটিউব লাইভগুলো দেন, আমরা সত্যি খুব গর্বিত।
আমার প্রিভিলেজ হবে।
Thank you so much. We're really honored and humbled by Dr. Gupta. আমার দীর্ঘদিনের সাংবাদিকতার অভিজ্ঞতা থেকে যেটা একটা জিনিস বোঝাতো যায়, একটা মানুষের ভেতরটা আমরা বুঝতে পারি। উনি অত্যন্ত, কঠিন শব্দে যাচ্ছি না, একজন ভালো মানুষ, ডাক্তার, সমাজসেবা, এইসব অনেক পরের কথা। ভালো মানুষরা আমাদের সঙ্গে জুড়বেন, সেটাই আমাদের প্রার্থনা ঈশ্বরের কাছে। একজন ভালো মানুষকে পেলাম, তাতেই খুব আনন্দিত বোধ করছি। সানশাইনের ইন্ডিয়ার তরফ থেকে প্রণীত হচ্ছে।